Welcome to the Beats from the True Wellness Center. I'm your host, Kelly Kennedy, and the Beats is truly from my heart to yours to help you empower and inspire you to learn how the body actually does work. I am bringing you my friends, my colleagues, the most incredible minds from around the world that I have been able to learn from, and I want to share them all with you. So that's what the Beats is really about, is teaching people what I've been able to learn about how the body works and trying to give that to you in a very simple and practical way to give you things to change your life, because you got this. This is all about you and having the ability to heal your own body from within. And that's really my message, is from my heart to yours. Welcome to the Beats. Welcome to learning how your body works, and welcome to opening your heart. Thank you for joining us today. Thank you for your time and your attention as we focus in on this week's episode of The Beats. Okay, welcome back to The Beats in the second half. We're over 100 episodes now of The Beats with Kelly Kennedy. I am your host and ever excited host to share with you my new tribe member, Dr. John Augspurger. Augspurger. I had it right the first time I said it. I practiced before I called him, but I've known of Dr. John for probably 15 years and have sent him clients, him and his beautiful wife, Ellie, although they have only been in Denver, I'd say for maybe 10 or so, if I have the timing about right. Mm-hmm. So our circle of bioregulatory medicine, as you all know, is quite small, and it doesn't often, we're always looking at the next thing and trying to get to the next seminar, and often our tribe kind of like, we know each other but we don't really get to know each other. And it's very good today that I'm excited to be able to have the opportunity to meet Dr. John myself and be able to introduce him and his brilliance and everything they do at Denver at their complete wellness center. They don't just do dentistry, they do wellness as well. Haha. So we're going to talk about how they bridge that gap, because as you all know, that for me, the heart of what the Beats is about is to educate you about how your body really works. And you cannot get well if you do not look inside the mouth. So I'm going to let John do his own edification and talk a little bit about his background. So Dr. John, can you tell us a little bit about, were you always a bioregulatory dentist? Did you start off as like, I just can't wait to pull mercury out of people's mouths?
No, not at all. No, I am really the course of my career goes by the saying, when the student is ready, the teacher appears. And that's really been the case in my life. So to make this as short as possible, it's really been kind of an interesting journey. It began when I was at 13 years old. My dad was an orthodontist, and I began in high school, or actually in junior high and high school. My dad trained me to be a lab technician. So I made appliances for my dad, and I was involved in clinical chairside adjusting and fitting and delivery of appliances. So not only making them, but, really making them fit and making them work. So as I went through college, I was always interested in sciences, but I'm also a musician. I'm a drummer, and I wanted to be a rock star and grow my hair out and, do that because I was pretty talented at playing drums and percussion. But then one day I got a letter that I was accepted to dental school when I was living out of a car in Los Angeles, trying to be a rock star. So I decided to come back to the Midwest. I'm from Iowa originally, and went to dental school. And when I was going through dental school, I learned that dentists had, at the time, and this was in the 80s, at the time, dentists had the highest suicide and divorce rate of any profession. And so for me, that was alarming. And so I just knew that I had to get my antenna up and see what's up with that. So when I got out of dental school, I happened to leave Iowa and go to Colorado Springs. And that was just the first place I got a job. And I worked for Blue Cross Blue Shield. I went into a PPO, and it was really an insurance-driven model and insurance-driven system. And I was within the first year, I noticed that I was really in the wrong place. And so I went into private practice. I bought a practice on my own, and I was a traditional dentist for 5 years, which means that I laugh when I think about it. I call it when I used to go to work and put my roller skates on and just really do whatever the insurance paid for. And that's really what my patients wanted. But it was, I call that disease care. I don't call that health care. So I happened to be watching CBS News on Sunday night one evening, and a guy named Hal Huggins came on in front of me and started talking about mercury, and that there was research that shows that mercury does not belong in the mouth, even though it's even though it's ADA approved and all that. And it really, the light bulb went off for me listening to Hal Huggins, who happened to be a dentist and immunologist. Okay. And so he was talking about mercury in teeth and how this is a very toxic material that off gases, and that we really have alternatives now with white composite fillings. And this is what dentists should be doing. And there's actually some safety protocols around that. So I was intrigued by that. So I called Hal's office the next morning and offered him dinner, and he accepted. And when I met Hal Huggins that night, when we became good friends, he really taught me a lot about what biological dentistry is and what it means. And when I went into his clinic, I was one of the dentists that went to work for him. And this was in the mid 90s. And I noticed that there were doctors and nurses involved, and that we were doing infusions with our patients. And the infusions were, at the time, were only high dose vitamin C. And I couldn't believe how much better patients did, from having, intense dental procedures and just having vitamin C infused, that where without that, I would assume that the patient would have much more pain and swelling afterwards, and really having a powerful powerful antioxidant experience at the same time as dental appointment. That really, we had protections in place. So I really understood at that time that we need to get the body involved in these dental experiences to really get the outcomes that we're after.
So let's break that down a little bit for clarity's
Sure.
sake. So what you're saying is that given what your training had been and what you had seen over the last 5 years, the procedures that were being done at Dr. Hal Huggins' office,
Mhm.
you would have expected or would have seen in other instances the patients not healing as fast. And
Absolutely.
what
With
you
way
attribute
more pain,
to
way more pain and swelling.
way
Yeah.
more pain and swelling. And then all of a sudden you walk into Dr. Hal Huggins' office, he's doing vitamin C infusions, the nurses are, in
Yep.
addition to the dental procedure, and you're
Yep.
watching the healing speeds increase with less pain. Just for clarity's sake, because I think vitamin C is one of the most underrated, like the lymph system, one of the
Yeah.
most underrated vitamins that people don't give enough credit to.
Yeah.
I mean, everybody's like, oh, I
Absolutely.
did a vitamin C IV, like it's no big deal. Like, that's huge. You just
Yeah.
got like vitamin C all pumped in through your cells. It's amazing.
Yep.
And if you really understand the power of that antioxidant, what it can do for you and how it can speed up recovery, I just think that was a significant scientific significance that you saw, which changed your mind about what was happening.
Yeah.
That's how significant this was. I just want to bring that to clarity. Okay, thank you.
Yeah. And I realized that was 25 years ago. And at the time, and this was all under medical directorship. So we had Tom Levy involved, who's a cardiologist in Colorado Springs, who's done a lot of work with biological dentistry, written books and done research. So I was impressed by just the fact that simply putting vitamin C infused in the body during a dental appointment had such significant improvements in outcomes. And so fast forward, then with Dr. Huggins and Dr. Levy and Professor Boyd Haley at the University of Kentucky shortly thereafter, I was one of the dentists that got involved in the research on root canals in the mid to late 90s. And we used Boyd Haley's lab at the University of Kentucky because Dr. Haley had the science to identify anything based on molecular weight. And Huggins was smart enough to know that the problem with root canals is off-gassing. Okay, so basically we have gangrene inside of a tooth. It's a root canal is an embalming or a taxidermy appointment for a tooth. And traditional dentists, the way we were trained was to, if there's a toothache, you take the life of the tooth. And only in dentistry is the mindset that if there's pain, that we actually devitalize the structure. Okay. You know, if your finger hurts and you go to the doctor doesn't say, well, we're going to take out the nerve endings, but what they don't tell you is we're also going to take away the blood supply. So when, you know, of course the pain's going to be gone because it's dead, right? But the problem is now you have gangrene inside the body, and the treatment for gangrene has always been amputation. Okay. Because gangrene is dangerous. So as dentists, we're trained to devitalize teeth when they hurt instead of healing a tooth. Okay. So more on that later. When I tell you a little more about my history, I'll come back to that. But so we got involved in the research, and there's a movie called Root Cause that came out about root canals and cavitations and all that in dentistry. And if anybody's not watched that movie, they should, because they did a good job discussing the approach of traditional dentistry versus biological dentistry. So, but it's a movie about the problem. It's not a movie about the solutions. More on that later as well. So, so I worked with Huggins and Tom Levy and Boyd Haley, and then about 6 years ago, we realized Dr. Rao in Switzerland was training all health professionals, and that was something that was really on my bucket list for a decade. I was just dying to meet Dr. Rao because I'd heard about him and what they were doing in Switzerland, and how they were training doctors and dentists, especially dentists, to involve the mouth, and they built a protocol around that and getting phenomenal results in chronic diseases. So my beloved and I, Allie, we went to Switzerland and trained there. And that's really where the BioDentist Way that I created, that's really where we got the foundation of that, and employing Swiss biological medicine to the dental experience, and in particular involving what's called the matrix, which is the extracellular matrix. It's the inner ocean, the saline system that surrounds all of our cells. It's tied to lymphatics. So that's a really huge part of the BioDentist Way as
Inner
well.
ocean. Like, I just need that to land on me for a second. Like I talk about the extracellular matrix all the time. I've never heard it in the terms of the inner ocean, and I'm such an ocean freak. That's such a great explanation for it. It's the inner ocean. Yeah.
Yeah.
Sorry, keep going.
It's a beautiful thing, because when you look at evolution and how we all got here, then of course it involves salt water, right? Right. And I tell my patients, it's where the cells poop, and it's how the bodies regulate, and it's how regulation occurs in the body is through the matrix. And you must have a healthy matrix. And this is where the mouth is so important, because it's the mouth that's upstream in the matrix that poisons the stream, that poisons the ocean, right? And it's when there's death inside the body, inside the cavitation sites, and inside the dead teeth, when people get root canals, okay, instead of vitality in these areas, okay, that's what poisons the oceans. So it's not only a toxicity, it's also a dysregulation from an energetic standpoint, and the flow of the meridian system, okay? So the approach, and the whole leaky gut situation too, as well, when we talk about leaky gut and gut health, well, the mouth is the gut, okay? And the problem that I have is when everybody's talking about leaky gut, they don't include the mouth and the sinuses and the tonsils.
Can you I know what you mean, but can you explain to them why you are saying the mouth is the gut? Because some people on this might be going, does he not understand anatomy? The gut is way below the mouth.
Yeah.
So why the gut is the mouth?
Yeah, great question. Well, here's what the definition of the gut is: lined by wet skin. Okay. So where it starts is at the wet dry line, right here at your lips and at your nose, you have the wet dry line. Okay. Where is it dry and where is it wet? Okay. And that tube, that hollow tube that runs through your body, begins at the wet dry line in the beginning of the mouth and the nose, and it ends at the very end of the anus. Okay. And that wet skin that goes through the body is all what's unique about the gut, and connected by that wet skin is it includes the mouth. Now, what is unique about the mouth is it's the only place in our bodies where your little, now I'll call them bones, but they're teeth, okay, where these little white things stick through the wet skin, and those are our teeth, okay? So a tooth is technically inside the body and outside the body both, okay? And that junction, that gap, okay, or that connection between a tooth is really the connection between the outside world and the inside world, okay? And if that gap is leaky, so when we talk about leaky gut, we're also talking about leaky mouth, okay, and leaky sinuses and leaky tonsils, which in turn causes leaky brain, okay, leaky everything really, okay. And so when people really aspire to have health, they have to have tight junctions between the cells in the wet skin system, the gut system, okay?
The wetlands.
The wetlands, exactly, right. So so that's what the BioDentist Way is really built on, is a protocol to how do we upregulate the gut system, including the microbiome. The microbiome is so powerful, okay? And the bacteria, we're more bacteria than we are our own cells, okay? And it's really the bacteria, what are the bacteria programmed to do? And the bacteria in our bodies are programmed to do one thing, and that is survive. Okay, the DNA of bacteria is so much faster than the DNA of inside the human body. And what we have to do as humans is we have to create the conditions so that the bacteria are more probiotic instead of pathogenic, right? It's really about the conditions, okay? And in the BioDentist Way, what we do is how we treat infections, rather than throwing antibiotics and infections, we strip the conditions on the infections, okay, so that the infections leave the body naturally, okay? And this is how we cure the infectious disease problems that we find in the mouth, okay? And the mouth is where these infections generally live, because like I said, it's the only place in our body where the little white things stick through the wet skin, right? So that's why we have to have those tight junctions there. And when we have that, we start to shore up the leaky disease inside the body, and then we start to see chronic diseases start to fall away. Now, I'm going to finish my history of how this all came about, because I also became a naturopath 5 years ago, and I do not have a license as a naturopath. So I do not say I'm a naturopath. I have 2 medical degrees as a naturopath. So now it's my language, it's my methodology, it's how I see the body is from a naturopathic perspective, even though I'm just a dentist, okay? But it's important to understand from a naturopathic perspective the power of the microbiome and the power of having a healthy gut wall in order to, build safety protocols around how we treat the mouth. So I know that was a lot, but that was...
No, you just kept getting trained because you wanted to get to the root cause. It obviously is what it boils down to help people truly turn this around. As you kept researching and going deeper and deeper and deeper, you ended at the inside ocean.
Yeah.
The inner ocean.
It's really all about the ocean and the gaps.
It's all about the spaces between the cells.
Mm-hmm. Yeah,
so
it truly is. Yeah, a healthy ocean, then the body can then regulate better. It can detoxify better. It's much less inflamed. Yeah.
I love how you say we create the conditions, because, I think the word responsibility is a scary word for people, but the reality is we do, consciously or not, we create the conditions in which our bodies live in, right? By the choices we make, by the things we eat, the things we think, the things we expose ourselves to or don't. And those are the conditions that the body's dealing with or not, and I think that just, we all create conditions all day long. Like, that's what you're doing. You're creating conditions for your family, for yourself, for your work friends, for your whatever. So what conditions are you creating for this body?
Yeah.
And I love that terminology.
Let's talk a little bit more about that, because there's something really important that I teach my patients about conditions. Okay. So infections. Okay. What are the conditions on infections? The conditions are acidity, stagnation, and oxygen deprivation. Those 3 things. Okay. So to knock out infections, Rather than acidity, we create alkalinity. Rather than stagnation, we create flow, okay, and movement, right? And rather than oxygen deprivation, we create oxygenation, and not with just any oxygen. We use ozone. This is where ozone comes in, okay? Because ozone is an oxidant, proactive form of oxygen. And ozone is really, in my practice, is the one thing that does the heavy lifting, okay, in my practice, where we use it for nearly everything, for whether it's cleanings or surgeries or fillings or anything. Ozone is what creates the conditions, that starts to create the conditions, especially when we're doing dentistry inside of teeth. Ozone creates it's a powerful disinfectant when it's done
Short term, like
short term. That's right, short term, because we all know the half-life of ozone is very quick, but the effect that it creates is very powerful. Okay, so anyway, back to the conditions. When we remove the conditions, then the infection can no longer exist. Okay. And that's why, in my opinion, using antibiotics, the conversation around that, we have to be very careful when we use antibiotics because it causes die-off, right? Nobody talks about when an antibiotic works, it creates a dead bacteria, it creates a corpse. And I call that the biological bomb site. Okay. And now and that's going to lead to stagnation, right? Now the body's going to be responsible for all that cleanup work when antibiotics are used. And this is where ozone is so beautiful, because ozone disinfects and is a powerful biological antibiotic because it creates proteinization. Okay, so it'll kill a pathogenic bacteria or a mold or whatever pathogen by blowing it into smithereens, right? Now we have proteinization, which is different than biological bomb site and dead corpses, okay? So now when the body has the proteinization from the pathogenicity, now we have a much faster antigen antibody complex creation there, so that there's much less swelling and inflammatory response afterwards. So we use antibiotics in our practice, but we use them infused, okay, during a septic dental experience like extracting dead teeth, okay, or cleaning out stagnation in the jaw bones in the form of cavitations. Okay, this is where we use an antibiotic because we need the kill, but we use the biological medicine right behind that to come in and clean it up. Okay, and doing dentistry in this way, especially when there's death inside the jaw, okay, with root canal teeth and old extraction sites that stagnated, okay, and didn't heal properly, we come in with using biological medicine really to clean that up. So the patients have a much better healing experience from, having a septic dental experience. Okay, so we really have to look at infections that many times are non-symptomatic in the mouth. People don't know they have these things, and it's really the role of a real biological dentist is to be the investigator, so that they can identify where these infections are. And this cannot be done without three-dimensional x-rays. Okay, 2D, you can't see it. Okay, 3Ds, well, I won't say you can't see it with 2D x-ray. I use 2D, but I also use 3D at the same time, so we can really get a good sense of where are these stagnation diseases, where are these infections inside the mouth that are, again, non-symptomatic. People generally don't know they have these problems. And so it's really important to treat infections, like I said, by stripping the conditions, not only that, but identifying where they are and not treating them one at a time. Infections are like fires. The fire department does not show up and put out multiple fires one at a time and then go home and wait 6 months, and then come back and we'll do the other one later because that's what, because unfortunately that's maybe because that's what the insurance, the patient can afford. That's not the right model. Infections have to be taken out all in the same experience, all in the same appointment. They must be completely removed, okay? Because an infection that has been treated cannot heal properly if on the other side of the jaw, you leave an infection over there, okay? And that was a big realization for me as a biological dentist, that all dead teeth come out and all cavitations get treated at the same appointment with the same protocols leading up to that appointment and during that appointment and after that appointment, so that the patient has the experience of having what I call having the hostage situation removed from their mouth. We get the vampires out all in one experience. Okay. So that then these wounds that are now proper wounds with platelets, okay, we don't leave open holes ever in people's mouths. We always put platelets in all the holes, okay, so that the patients have no holes left in their mouths to clean out, so that now these wounds, the body knows exactly what to do with the platelets. And the platelets release growth factors. They recruit the stem cells in the immune system to the areas. So now what we have is, I talked about that poisoning of the upstream. Okay. So now when we clear the toxicity coming from the stagnation, the death areas inside the mouth, once we clear all of that completely, patients typically are amazed at how they feel after having these since which really started when they get their wisdom teeth out. Like when people are 20 years old, they've been living with the stagnation disease for all these times. And of course, a lot of patients have a root canal or two. Okay. Because even some biological dentists do root canals, right? And so when a patient goes through this experience of having all of these chronic stagnation infections, all these inflammations lifted from the body safely the next day, rather than pain and swelling and the typical, you would think, from having these kinds of large surgeries performed, it's actually the opposite. Patients feel amazing because now we have just cleared and cleaned the poisoning of the inner ocean. Okay.
I would imagine, I just have to say at this point, because I've done this for a long time too, and I know what people that are super compliant, I don't want you to run to your biological dentist and have everything taken out all at once. This is not medical advice or dental advice or anything else. I just want to bring your attention to, there's a lot of preparation done to get the body ready to go through that kind of extreme work.
Yep.
Because I would say that I have seen the opposite effect as well happen, in all honesty, where people get a lot of work done and they crash because they weren't properly prepared
Yes.
to go through that process. So
Yes.
please understand that everything at the right time with working with the biological system, working with the flow state, working at the pace that the body wants is key, unless you're in a position where you're trying to save a life.
Correct. Yeah. Yeah.
Sorry. I
Absolutely.
just, whew,
Well,
that was like making my heart flutter a little bit. I was a little stressed over here. I started sweating because I know these listeners and I know they're very compliant, and I don't want them to go so fast and so hard, because as my personality would present, fast and hard is how I used to like it. But what I've learned and have been taught over and over by physical body is that you can only go at the pace at which the body is ready, willing, and able to go. So
absolutely. And I was just getting to that.
sorry.
So
That's just, you haven't gotten to know me yet, but that's,
yeah.
Maybe you should have had Dr. Rao give you a warning about me and my personality before we chatted. No, go ahead.
No problem. So in the BioDentist Way, what we've created is here at the Human Universal Health Institute, we have the medical side, okay, under medical directorship, okay, and we prepare our patients well in advance, at least a month in advance. And like you said, in acute situations, we deal with acute situations biologically as well. But in these chronic situations, we take great pride and emphasis on preparing the gut system. We believe strongly in preparation of the wet skin. We use colonics with ozone here. We use infusions. We introduce biological medicine in the form of ozone, ultraviolet, 3 different kinds of ultraviolet light, high dose vitamin C, homeopathy, B vitamins, Myers cocktails, all of these kinds of things. We also pay a lot of attention to the airway. If people snore, then they can't get the oxygen levels in their blood at night, and they're not in a parasympathetic state when they're sleeping. So these are all the things that in the preparation of having appointments like this, we have what's called, here at BioDentist, we also have what's called BioVital, and that's the clinic that we have that's really the medical side under medical directorship, where we do our testing and we do our infusions and colonics and supplementations and gut wall upregulation and extracellular matrix upregulation, so that we really have prepared a patient thoroughly prior to having these chronic inflammations and silent infections removed from the jaws. And we also do the dentistry at that point. This is the time we don't allow tooth decay in the mouth. We don't allow teeth to be in sympathetic lockdown. We get the bite balance. We get the front teeth guiding and protecting the back teeth. And like I said, we get the metal, we get the decay out, we get the metals out. And this is where we can really do the dentistry to get the teeth all in parasympathetic, so that the teeth are long and sharp and balanced and beautiful. Okay. And we do this conservatively. I don't like doing a lot of crowns in my mouth. Like I said, I'm a lab technician. I build teeth with my own two hands. I'm a sculptor. I like using filling material to build and balance. You can always do crowns later if teeth are too weak. But I see a lot of people that get all these crash helmets on their back teeth, on their molars, because their mouth is in such a sympathetic lockdown and they're breaking their teeth. And
can you explain that a little bit? Like, okay, I mean, I know what you're talking about, obviously, but okay, you're saying a helmet and a cap. Because you have to understand, I'll never forget the first time I went to the first biological medicine seminar with Dr. Thomas Rao. And I literally turned to Ian, and I'd been doing this for about 10 years, 15 years, doing energetic work, vibration work. And I turned to him and was like, dentistry? We have to learn dentistry? I don't want to learn dentistry.
Yeah.
No offense. No offense. But I had literally been to the dentist maybe 3 times in my life at that point. Like, we were not big. My parents were on the lower end of the socioeconomic scale. My dad was very sick our whole life. Thank God we had pretty good teeth. We didn't have cavities. I had one cavity when I was 20 years old put in my mouth. So, or one filling rather. But so when I first started learning this, it was all new, a language, like a cap, a crown, an implant, a root canal. I literally was like, what the hell are they talking about? What is a cavity? So back up. What's a crown, and why is that akin to a crash helmet?
Yeah. Well, I call crowns crash helmets. Yeah. Right. Yeah.
And
Because I
bite
see a
and
lot of them.
sympathetic. Like, I know, can you break down the bite and the sympathetic and the parasympathetic so that they understand that in a very slow,
Easy way. Yeah. Gladly. Okay. So we have two kinds of teeth in our mouth. We have front teeth and we have back teeth. We have cutters and we have crushers. This is how we eat. We cut, crush, swallow, right? Your front teeth do the cutting, your back teeth do the crushing. Okay. Molars are the crushers. Incisors and canines are the cutters, right? They're your front teeth. Okay, how the body works neurologically is the front teeth, just like our car, our front tires steer our car. Your front teeth steer your mouth, okay? And it's important to have long, sharp front teeth so that the guide planes, or the contacts as your jaw moves, whenever your jaw moves, you want to be touching your front teeth. Whenever your jaw moves left, right, forward, you want to be able to feel your front teeth, okay? Not your back teeth. When you feel your back teeth, when you guide in directionally, when you guide, then that fires the masseter muscles. Okay, that's the big powerful muscles in our cheekbone, under our cheekbones here. That's the masseter. The horses have great big masseters. Okay, and when people have the masseters firing, okay, we call this bruxism. Okay, when people grind their teeth, it's because there's so much wear in the mouth that the front teeth cannot protect the back teeth anymore. Okay. It's kind of like buying new tires, one tire at a time, without aligning the steering. It's ridiculous. Okay.
Oh, that's good.
It's ridiculous, right? You do not buy tires. If your tires are bald on your car, you do not buy tires without a spin balance and alignment, right? Why are we doing dentistry any differently? Okay. I see so many dentists putting crash helmets on back molars as a, really, it's all about the repair, fixing the broken tooth and looking for cracks and doing same day crowns, when in fact we have to stop and look at the front teeth and see, is the wear and the disease and the destruction in the front, and build the front first. Okay. So that then, because that dictates what happens in the back teeth. Okay. So I approach the mouth in such a way to get it out of sympathetic lockdown, which means stressful lockdown, by putting the balance and the contacts up front so that the front teeth are long, sharp, and beautiful. Okay. And we can do this with very conservative filling material, conservative restoration, rather than doing a lot of crowns or veneers or things like that. We can sculpt this as long as we don't have an orthodontic problem here. As long as the teeth can come together in such a way where we can build that in front. Now people love that because really the process starts with a beautiful smile. Okay. And we can help with the musculature and the TMJ problems and things like that by getting the sensory information coming properly from the front teeth. Then we can go to the back teeth and build them to be tall, sharp, and balanced. So now that we have teeth that are knife blades. Okay.
So this would be as opposed to, in your analogy of a car and tires. So I have a car that has a tire that's bulging. I get my inspection, and instead I go, just give me one tire. I only want one tire done.
Yeah.
But never thinking about, well, why would one tire wear? You're not like running down the road just one tire. So that
Right.
means that your alignment is off and the balance is off in how the tires are running down the road.
That's
Your
right.
body's no different. So
That's
as
right.
your teeth are moving, what Dr. John is saying is that if the bite's off, you're over wearing on one side and they're putting a crash helmet on, like
Right.
one tire, and just
That-
going, okay, you're done. But it doesn't correct the causative issue. And so there's going to be further damage down the road. And what he's saying is we back up and go, let's get all your tires to have proper contact with the road at the proper times so that you're balanced.
Right.
And now we're preventing further issues
That's right.
and
'Cause we-
getting these masseter muscles, which you guys all know if you've been in my office, and you know if you've listened to anything. Like, this is a big deal. This is where we hold our stress, and that's why you're grinding and blah, 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 and you're creating all this stress down here. But these muscles will continue to tighten and contract if they're out of alignment from just postural, not wanting you to fall forward.
That's right. So what we have to remember here is every tooth has a blood supply, right? And if we're gonna put these molars under all this compression from not only vertical directions but lateral directions, this is the reason why this is where teeth are in parasympathetic lockdown at that point. They're in a stressful state. All right. And if teeth have blood supplies, okay, and there's all this compression happening with teeth, this is the reason why teeth don't heal. Right. This is why people get all this dentistry. When you look at adults, where's all their dentistry? It's in the back of their mouths. Okay. It's where it starts and it kind of moves forward. Okay. And people just break their teeth and, they have their insurance. They go to their insurance dentist. And then this is, insurance is just incentivized disease care. It's all, I was trained as a tooth mechanic. Okay. Not a biologically minded dental physician. Okay. And really what people need is they need all of the conditions corrected in their mouths, like I talked about before, during, and after, so that we have a parasympathetic state. We have a stress-free, relaxed, biologically coherent mouth so that we don't poison our bodies from our mouths from all the dentistry that's happened through the years, because that's the way dentists are trained and that's what insurance pays for and all those things. Okay. Instead of, what is biological dentistry and what is biological medicine? How do we merge the two? So, because the body is connected, okay, the teeth are connected to the body, and to practice in a silo in dentistry, I think it's a really big deal. And there's a lot of disease happening as a result in the hands of the dentist, whether knowingly or unknowingly. There's a lot of chronic disease that can be traced back to the mouth. And if Dr. Rao were here right now, he would, and he was the first one that brought this to my attention, that research shows that 70% of chronic disease, and I think it could be higher than that, 70% of chronic disease can be traced back to what's happening in the mouth. And the stagnation and the gangrene and the dissimilar metals in the wet acid environment creating the batteries and the sympathetic lockdown that's in the mouth, and and the dental industry set up to be high volume and high, basically a manufacturing model where people are getting all these things done, and it's not healthcare, it's disease care. And let's stop calling healthcare. It's actually disease care. And it's, and dentistry is responsible for so much of the problems that people are having. But the problem is, the dentists don't see it because we're trained as tooth mechanics and we have high tech. Okay. So we have all this technology that we can use to make dentistry look like it's this really, I want
Fast
to be,
moving
I want to be
car.
nice to my profession here, but
Yeah.
I'm frustrated. I'm obviously frustrated that we are not trained to see the body biologically, and and with in such a way where we really take all the things that I've talked about today into consideration as we build a treatment plan and work with the body and the power that the body has, the innate healing capacity of the body, so that we start to unlock some of those locks that are there, so that we can use the body the way it's designed to heal, and apply that to the practice of dentistry, so that we get the body involved, and we heal the mouth, we heal the body at the same time. And it's such a wonderful experience to have been led in my own life, been led down this path, and having gone through all my trainings and all of my research that I've gotten involved in, and then finally getting to Switzerland to really get around the doctors that see it that way, and then be able to practice in this way. So it's just it's really, I would not be a dentist today if it wasn't for coming across these kinds of modalities and technologies and protocols, and building things in such a way that we can really apply very very simple rules to how to go about to restore the mouth.
Just like in any profession, you can work at somebody that just has been doing it for a little while, or somebody who's an expert, right? Or I find in so many fields, particularly ours, that the more training you get, sometimes it can like narrow your expertise at some level.
Yeah.
And what I found with bioregulatory medicine is it did the exact opposite. It like opened you up to like, oh my God, now I have to know everything. I have to know neurology and dentistry and medicine and all the things. And it's like all the things you have to know and understand, because we are all the things. And if you compartmentalize, then you're missing a piece. And I always go back, I was pre-med at Cornell and I switched to pre-vet because of a personal history medical experience. And it still cracks me up that in all of that schooling, the first thing we're taught is to look in the mouth of the animal, to look at the gums, look at the teeth, look at the tongue, to know if you need further investigation.
It's the window to the inside of the body, truly.
And then years later, 10 years after I get out of Cornell, I introduced to Dr. Rao, and the first thing he says is you have to look in the mouth. And I was like, well, that makes sense. Yeah, where did this whole thing come from? And then my friend, Dr. Caratola, whom I'm sure he's like, why has this been separated? And then he did all the research to find when medicine and dentistry kind of really stopped being taught together. But it now, like looking back, it's like so weird and illogical that there's an entire group of professionals, dentists, that are taught that these are outside of the body and have no connection to this.
Yeah.
And yet the root system lays in it.
Yeah.
That's like the tree doesn't matter the soil that it lives in. Like what?
Yeah.
That's crazy town. And so, you say, well, I'm just a dentist, but I would argue differently and say, as Dr. Caratola says, you're a physician of the mouth that understands that what you're doing is impacting everything, and that everything is impacting this. And so you have to look at, okay, now that we looked at your bite and all that, why are you so stressed that you're grinding? Or is it parasites? Or is it emotional stress? Or is it improper structure of the body? Or all the things? Is it all the things? Is it mold? Right? I mean, so let's go to the wellness side, right? So you have this dental side and you have the wellness side, which is very unique in the United States to have these two. This is one of the things that set aside so many of the clinics that we've learned from and have grown out of, I will say, at a little bit of a level. In Europe is these clinics that house both dentistry and medicine to get them to communicate together and work together hand in hand, mouth and body. So I heard you say you have ozone, vitamin therapy, light therapy, colonics, IVs. You have some kind of, I'm sure, practitioners that work with gut rehab from a supplementation perspective as well. You work on airways on the dentistry side. What other therapies do you offer at your so the BioVital is the medical side, right? BioVital or
Well,
BioVital.
here at the human, we have the HUH Institute. It stands for the Human Universal Health Institute, huhinstitute.com. Okay. And under the HUH Institute, we have wellness services and we also have education. Okay. So on the wellness side, this is the BioVital. We have what we call the vitality services. Okay. And this is our part of the BioDentist Way, that prior to a dental experience, we begin with treating the body. Okay. And we start to upregulate the systems and improve the gut conditions and upregulate the probiotic bacteria, all the condition things I talked about. So we have BioVital services. Okay. And this is the more out, this is really, we've had, because of how under licensures, you really can't practice dentistry and practice medicine. So we've separated that into separate businesses, one being BioDentist and BioVital. And we've set up a private medical membership association. Okay. So that we've privatized the medical side so that it's membership based, right? Okay. And if anybody wants to know about that, they can look it up. But being membership based, we practice member to member as opposed to doctor to patient on the medical side. Okay. So the vitality services is where patients, that's where our nursing is involved. That's where our colonics are. That's where our supplementation is. That's where we even do skincare there. Those kinds of things. So that's prior to having a dental experience at BioDentist. This is where we begin, because we really have to. This is what I teach my patients. You have to study before your test, right? You have to learn how to handle the ball before the coach puts you in the game. It's the same thing. You have to prepare the body for an upcoming dental experience. Okay. Especially if there's dead teeth involved, or if there's cavitations involved, we get the body, we get lifestyle figured out.
Do you do blood work, assessments, stool analysis? Like, what kind of assessments do you use over that?
Well, we do airway assessment, that kind of thing. We recommend supplementation. If we're going to do blood work, I really like to be working with the patient's doctor at that point to be doing blood work. Those kinds of things. As a dentist, that's not something that's under the scope of my license, but we like to, we have.
Oh, you on both sides. I didn't realize that. Okay, I get it. I thought you had somebody else running the other side altogether.
Well, we do. Yeah.
Okay.
So BioVital and BioDentist are separate businesses.
Right.
Yeah. So, and that's over on the BioVital side is where we have the vitality services and the testing.
Right. And so
I didn't
you don't
mention
do any assessments, or you don't do heart rate variability or anything?
not in BioDentist.
Gotcha.
Yeah.
In BioVitality, do you?
In BioVital, we do. Yeah.
In BioVital, you do. You do heart rate variability. That's what
I was going to mention HRV as well. Yeah. That's where those kinds of things. So yeah.
Cool.
Yep.
And so if somebody is looking for, tell them where you're located, because I mentioned Colorado, but just
we're in Denver.
Yeah.
We're in Denver, Colorado, and we have the Human Universal Health Institute here, and we're all, like I mentioned before, we're also based in education as well. I teach classes. We have a thing called the Founder's Message, so a lot of our new patients that come in, they can come in and they can learn from us at first to just see if this really is something that resonates with them. In our approach, because, people really have to be on board with this. It's a big commitment. It's a big investment as well. It's not cheap. It's just, until there's a different, until the government pays for something like this, it's, this is a large investment and a large commitment. And when patients come in from all over, we don't see a lot of patients here. We only see a select few patients that are really on board with what it is we do. And when they come to Denver, they typically stay for the week or stay for 2 weeks at a time. But they're really with us. It's really like going to Switzerland for healthcare. That's what Allie and I do. We go to Switzerland, and when we go there for healthcare, it includes food and everything. you know, we also have a chef and a garden, and, you know, our food is included in our model here, because we just really have to really encompass all things in order to create wellness. So we can't have people leaving and going and eating fast food.
Oh, that's really nice that you offer that. I know when people come to True Wellness, they're always like, "Do I get a lunch break?" I'm like, "No, we call it intermittent fasting while you're here for services." No, it's kind of an ongoing joke because I really don't schedule a lot of time for people to eat, but I always am like, "But make sure you eat good when you leave." And we have like this list of places and, you know, grocery stores and different things. But that's a really great. I mean, that's one of the great things that I saw when we went to Switzerland, that it makes it so much easier for people. And I know we're working on a remedy for that as well right now for our long distance traveling clients, because you cannot, I mean, we've all learned how to nurture ourselves when we travel, but that is a skill set that often takes years to learn how to hone in, to
Right.
go into a Wawa and find the healthy thing that's in there you can actually eat. It's actually can be done. It's, you don't eat a lot, but you can get by. But it's not a way to nourish yourself when you're going through a therapy like that. So it's nice that you do that. It's so nice that you do that.
Yeah, 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 yeah.
Well,
Makes it
that's
easier for the
awesome.
patients. Yeah, yeah,
So it's humanuniversalhealthinstitute.com,
yep.
right?
Yeah.
And
It's huh.institute.com. So huhinstitute.com. And that's where,
you,
if anyone's interested in
huh,
what we're doing, they can go to
huh,
that website. Yep.
huh, institute,
Institute.
huh, institute.com.
Yep.
Okay.
Yep.
Huh. I love it. Hutinstitute.com. Awesome. And is there anything else you want to share with the community? I mean, I really appreciate your time today, and your background is amazing. And you know, I don't. If this is the first time you're listening to the dental aspect of the beats, go back and listen to the first 100 episodes, because you missed about 30 episodes about dentistry. Because one of the things that I know from my heart to yours is that you cannot heal if you don't heal the mouth, as we have exemplified today. And it's all about timing and going at the pace that the body's ready for and all that. But this has been such a great recap for some people that have listened to this before. But if this is new information for you, I hope that we've raised more questions for you than we've answered, because then we've done our job. We've gotten you to start to think about it in a different way and start to think about your health and your journey and who needs to be on your team that's trained properly. And I know, Dr. John, you don't just train clients, right? You train practitioners as well, and dentists to do this type of work. So not every dentist is closed off to this. So have conversations with them, let them know we need more dentists on our that are physicians of the body, not just mechanics of the mouth. But is there anything else? Kelly will stop talking so that you can actually talk once I ask you that question. Go for it.
Well, yeah, there is. You know, I want everybody listening to this to realize that the mouth is a really, really, really big deal. And throughout the course of my career as a biological dentist slash tooth mechanic, I've been able to learn a lot of ways. You know, how do we get good results? And we get good results by merging biological medicine with biological dentistry. And, you know, I am here now to train doctors and healthcare professionals and their staff. I feel strongly that there's really a big conversation to have about the mouth and the whole entire gut system and the extracellular matrix, and really making a dental experience, just really appreciating the mouth for its design and for its importance in overall health, and opening that conversation so that we can all learn as professionals, how to look inside the mouth, okay, and what do we see, and how to go about that, and how to work with a biological dentist that is truly biological, okay. Yeah. And so that really it's about the people and bringing about health to the people and our planet, and it's all interconnected. And so, you know, as I continue as a dentist, it's going to start to look differently. I'm, you know, going into teachings and trainings, and that's what we have here in Denver. We've built it, and it's here, and we want to invite the conversation, and we want to invite the people to come to Denver and be part of our community here, and to gain whatever possible they can gain. Because like I said, when the student is ready, the teacher appears. And that's worked very well in my life. So
Awesome. Well, thank you so much, Dr. Augspurger, for your time today, truly, and for what you've created. And to your partner, Allie, for what you both have created and hold space for in healing and for people's part in that journey. So thank you for that. And thank you all for listening. And if this resonated with you, we do ask you to go ahead and share this with people that might be also interested in, that can help them along their journey. And make sure to make your comments and notifications so you know when you're going to hear your next Beats episode, to get insight and information and some wisdom and some questions in regards to what the root cause is. And truly, from our heart to yours on the Beats, you got this. You have an amazing physician inside your body.
That's great.
And we'll see you next time on the Beats. Have a great day, everybody. Thank you so much for listening today to this episode of The Beats. And as your host, Kelly Kennedy, truly from my heart to yours, thank you for your time and your attention today. And if this did resonate with you, please do leave some comments. We would love to hear from you. And if this further you think would resonate with somebody that you know, please do go ahead and share that and hit that notification button so you know when The Beats is available to you. We do some live things every once in a while. And as always, we pray that this information today was not only foundational, but raised some questions for you and helped you be empowered to take actionable, profound steps toward regeneration, because your body is the only thing that heals. And that is our message here on The Beats. Thanks again for listening and for sharing. Have a great day.